Right, let's make a beginning. Welcome everybody. This is the third, I think, last of a series of webinars from the Recovery College Network. I'm Jeff Shepherd, erstwhile chair of the IMROC program, and I've got the great privilege and fun, really, of chairing this webinar on co-production in recovery colleges. And I'm going to be joined in that by Jane McGregor, who's on the line from Cambridge, who's somebody known to many of you who's been studying the recovery colleges. And here in London with me, Sarah Meddings. Hello, Sarah.
Hi.
Sarah's been very much involved operationally in the recovery college at Sussex, and also, I think, the leading person doing research on recovery colleges in this country. And also Waldo Rowe.
Hi there. Yes.
And Waldo's known many of you. He's a service user trainer, and also worked in the CNWL Recovery College. Now, this idea about co-production, it's really becoming quite fashionable. We've been noticing it appearing in various places. But it's one of those words which is kind of easy to use, but sometimes a little bit difficult to understand. And we want today to get beyond, as it were, the theoretical ideas around co-production, although they are very important, and we will touch on them, but also talking about the practical implications of how recovery isn't just one process. It's actually an approach to doing, as it were, services and service development. And in the context of recovery colleges, it applies to not just to formulating the content of courses, delivering those courses, who hears those courses, questions about evaluation and quality assurance and so on. It's a theme of a way of doing things which hopefully will become clear with the example of recovery colleges that we have today. So just as a way of introducing ourselves, getting into that, I'd like to hand over at that point to Jane McGregor, who's just going to talk very, very briefly about the background of the Recovery College Network, which many of you will know, and the central notion of co-production in recovery colleges. So Jane, would you like to take over for a couple of minutes?
Thanks, Jeff. Well, as many of you will know, we in England have the largest number of recovery colleges in the world. It's very much an idea whose time has come, and I haven't written down about the ones in Japan, in Australia, Germany, Belgium, and so on. We set up the IMROC Recovery College Learning Network around about a year ago. We now have 18 subscribing members, 6 being virtual, partly by virtue of being, for example, in Sydney, in Australia. And we've had 3 different learning days. The second 2, it very much in response to demand from the people in the room, who generally centre around maybe about 4, 5 or 6. And this is the third webinar before we start the new round of different events and so on. And this one on co-production was very much in response to the last learning set, where we had a significant number of new member organisations who were very interested in pulling apart and building on the notion of co-production. The second slide here shows a free booklet that I think some of you, or most of you hopefully, will be familiar with, from Perkins and et al., published extraordinarily only 4 years ago. And one of the defining features, central features of recovery colleges is that there should be co-production at every level and every stage, from initial planning and development to operational decisions and quality assurance. Now that's to say that if you don't have co-production between, say, clinical staff and service users, some of which who may be clinical staff as well, then it may be something else, it may be something very good, but not what we would call a recovery college. In some of the most recent research, Tony King, who is down in Portsmouth, who did her master's on co-production, found that co-production was rated by those taking part in the fairly extensive research. Co-production was rated as the second most important feature of recovery colleges, a defining feature, second only to recovery principles. So we are starting to get more research coming through from people like Tony and, as Jeff said, Sarah. Okay, thank you. What's co-production?
Okay, thanks very much, Jane. I think that leads very neatly into some discussion now led by Waldo about what IMROC really understands by this term co-production. So I hand over to you, Waldo.
Yes, and I think it's really important that co-production is really doing things with people rather than for or to them. And although co-production, I think, is central in recovery, we've come a long way. It really does challenge that process of around issues of power and transparency. And I think that gets right to the heart of it, especially around transparency and how transparent those issues can be. And within our hierarchical systems where accountability is so heavily thought of, I think it can be really difficult for people within services to think around relinquishing some of that power. And I think co-production, recovery colleges and its understanding of co-production, which at the moment seems to work really well, goes right to the heart of trying to transform a wider sense of what co-production has to mean within services generally, whether that's around like in recovery conditions in that arena and physical health, and certainly we're now the Recovery and Wellbeing College, and looking at how to do courses around palliative care and how can co-production and how can that be at the heart of all of these issues. I think for all of us to think of. So right at the very end of that spectrum of co-production is around shared decision-making and pushing that agenda all the time, and how to be supported to actually take an active role in what their difficulties and work might be with them. So I guess really, just to...
Yeah, sorry. Well, can I just pick up on that, because one of the things I hear you saying there is concern, and I think this is kind of the IMROC view, that co-production isn't just a kind of narrow technique that you use in order to produce a course in a recovery college. It's got a kind of broader meaning than that. Is that
Absolutely,
right?
Absolutely. And I think the recovery colleges at their basis are around giving an element of choice and control back to people using services and to the staff. And it's acting in a sense as a Trojan horse, I think, that drives that change throughout the organization. Because at the very heart of it, and we'll look at it in a minute, it is about transforming how we deliver services. It isn't a bolt-on to how we deliver services at this moment in time.
Right.
And I think it's about changing the landscape of that. And, you know, certainly within our trust, you know, it's become a buzzword, co-production, and all of the departments within the trust now are sort of talking around it, talking around recovery, whether it's explaining the Care Act to Carers Network or whichever, the rehab service line that we have. But that's driven partly by the success of the recovery college model. And I think that creates the discussion, but the landscape isn't changing. They're still wanting to bolt it on. And I think we'll look at a sort of ladder of where we're going later within that service. But I really feel that recovery colleges need and are acting as the catalyst for what co-production is going on.
That's very interesting, Walter. Thank you. Let's move on to your second slide.
Yes, I mean, I suppose, right at the heart of co-production is looking at how we change the actual core economy. And move it on. And Nesta and the New Economics Forum have issued a lot of briefing papers around it. In the course that we run in the Recovery College, we show some of the YouTube clips from the Sky, the social care and excellence, and they're really they're a big driver of that co-production in an organizational way as well, in a large organization that works. And it's not the same as consultation. It isn't tokenistic. It is about the participation of people who use services and their carers. And it's about that power sharing. And that's a big change for us. Both people that use services and the people that deliver them have a lot of way of learning to do about how both to I suppose, accept an element of responsibility and for people to surrender an element of responsibility, and for that to happen. And I think within public services, creating that equal and reciprocal relationship is particularly difficult in the way that services are delivered in this country at the moment. But when the pockets where it has grown, and there are pockets where co-production has grown, it does seem that services become far better agents for change and in creating networks and attachments to their neighborhoods and things.
So you're envisaging a wholly kind of different kind of mental health service with different kind of components and organized in different ways to what we've conventionally think of, as the NHS at the centre doing everything and a few other bits tacked on around the sides.
Absolutely, and I think, I work for a very big central North London, West London trust that covers a huge, and it's very hard not to become subsumed by the organisation just to get the work through the work. And I'm constantly reminded of how peer support on the wards, the peer support workers actually have to stop and step back and rethink about actually what am I doing, and make a connection with the people, because it's so quick and easy to become just another care assistant in the same mold that's going on. And it's around that we struggle around co-production. How do we not become subsumed by the organisation and become just another part, another service that's delivered by the organisation, rather than that catalyst for change?
Great, thanks very much. And are there particular principles that we just need to list as being key kind of guiding ideas?
I think so, yes. And I think that New Economics Foundation have set out a set of principles that really, I suppose, underpin what we understand recovery in the Recovery Colleges is being central to co-production, recognizing people as assets and recognizing what people can do at any point in time. It's not about being a brilliant asset. It's just about everyone having an asset and being able to build on those on people's existing capabilities, and mutuality and reciprocity. And I think that's probably the hardest one to really embed. I think we're used to sort of trying to think about strengths and strengths-based things, but how do we create a mutuality and a reciprocity, especially when we're thinking about where involvement has gone within our organizations? How do we create reciprocal value to what people are delivering to us, other than just wanting voluntary input? Creating and engaging those peer networks is really important, including families and neighbours. And I think, again, in Recovery Colleges, that's where we do a lot of talking around being outward-facing. But again, our organisations are so silo-like that we end up actually voicing those. It's really important that we create those networks. And that's about breaking down barriers, and there is no better place than recovery colleges where I've seen that happen. And I've heard you speak, Jeff, about it, and it is definitely the magic that takes place within the courses that we run is around breaking down of self-stigma and the stigma held around different difficulties and challenges that we all have. And I see that broken down all the time within that arena, and that's another of those important principles. And facilitating rather than delivering services. And again, within recovery colleges, I think we're at pains. It's very difficult when we've got a very big recovery college, 90 courses within our recovery college that we're delivering. When we're trying to recruit professional members of staff, occupational therapists and social workers who've run and delivered an element of therapies that look like they might easily translate into courses, how do we make sure that they're both started as blank sheets of paper and that they are facilitated in a facilitative way rather than just being delivered as another coercive education element. So enabling service agents to become catalysts of those changes is really big.
And so would it be right, Bodo, that it's very tempting, you know, in the busy world, as it were, if you want to run a course on managing psychosis, you go to the textbooks, everybody's read the textbooks, and maybe somebody's already written a course somewhere else, and you just take that off the shelf and do it. Now, I have a sense that co-production wouldn't quite think that was necessary. Well, it would think that would miss out something that's really valuable if you just kind of take things off the shelf like that.
I think that's a good point. I think we're going to sort of explore an element of that because I think I keep going to things. I've never done this thing called cuff training, and I've not had much to do with it in the past, but because that's had an element of service, user input and professional input, is by bringing that in and putting it into the recovery college, does that mean that we're acting in a co-productive way, or is that just another part of patient involvement being put into it? So are we talking about the recreation of something, or actually just looking at where we can cherry pick ideas and especially within physical health as well, with the expert patient program and its educational element to it? What is that at the heart of it? And I think personally it is about recreating something and starting from scratch, because it's about as much about that breaking down of barriers, that fifth principle, as about the use of who you're using to do it. So,
can I just say, Walter, that when I was in education proper, so to speak, in schools, we did a lot of work around pupil voice, we called it, and then we called it pupil involvement. But you're quite right in saying that this goes beyond involvement. It's not just having somebody along in the same room, or somebody giving out worksheets at the end of the session. It is, as you say, about co-creating something.
Yeah.
Very important.
Well, that's been very helpful, I think, and I know Sarah's keen to pick up some of these themes later on, but I think we've got just a slide or two more from you, Waldo, just to kind of bring things together here. We talked about what co-production is. What about what co-production isn't?
Well, I think, we've had this slide in the co-production course that we deliver in our recovery college, and I think it's something that we're at pains to really point out, because I think especially in the climate that there's a lot of people that say that they're doing things that are co-productive when asked, or that we're working with co-production. It isn't about planning a service and asking for service user comment or its involvement, nor is it about wheeling people on to tell their story of woe. It's about being involved from the outset, right at the very beginning, starting with a blank sheet of paper. Asking peer trainers to represent people who use a service when they themselves do not use it but are employed there. It really isn't about that. It's not around token representation. It really is about that equal partnership. And I have to say, and we pick it up later, it means things take a lot longer. Aims and outcomes are decided by managers and clinicians, a very difficult one within a hierarchical organization that has a lot of targets set outside its organization by government, let alone within the organization. But it is around, but outcomes and the equality, the quality assurance of everything has to be created, and the policies created at the beginning by the people that are going to be doing it, and that's why we're so at the beginning of this journey. It isn't around service users designing or running services, and there's a great call for that. It's not about running that down. That isn't co-production, but there is nonetheless a great need for service user-driven or things, and it's not just about service users and providers. It engages all people's skills and all of the communities. So it might be about using organizations, and I think that's how we can drive to look more outward facing. I'd also like to say it isn't a way of saving money, because in the long run it might have an element of that attached to it at some point, but these ideas were formulated and formed in a time when the economic situation in the country and the world was at its peak, at its very best. There was more money being put into things at that time than before. That really is an important point, that it isn't around saving money, I think.
Very good, Waldo. Yeah. And I think, isn't it, on this participation slide, which people may have seen before?
I've sort of had this before, because I think we started 20, 30 years ago, and certainly when I was over the last start was using services, that the idea was just about informing and engaging. We've really come a long way with involvement. Our trust is fantastic at service user involvement. In actual fact, it doesn't recruit anyone without asking someone to be on a panel. And I think we've got to that middle point where we are consulting people, we are engaging people, and we're going out there, but we're still doing for them. And actually, we need to move how we move. And I think recovery colleges are at that tipping point where we are doing with, and we are co-producing. We want to drag the rest of it with us.
Well, that's very good, Waldo. Thank you very much for that. And I think, you know, one of the things you were saying earlier on is about how the recovery college provides a kind of vehicle for illustrating what are in fact quite broad and extremely fundamental principles when you think about how services should be organized and run. But let's get back to the detail of recovery colleges and look at co-production in quite practical ways. And I'd like to bring in Sarah at that point.
Hi. So yeah, I guess we're thinking about co-production in terms of every aspect of recovery colleges, and maybe that's one of the ways that, as Jeff was saying, recovery colleges can demonstrate to other parts of organisations and the mental health system about how co-production can be central to everything. But co-production in everything, and also from the very start. So, for example, in thinking about developing recovery colleges and thinking about how do we measure outcomes in recovery colleges, wanting to not be thinking about only bringing people in at a later point, but right at the very beginning, including people who be using services, people who experience mental health challenges, people maybe who are carers of people, and the staff working in the organisations to think together about what would make a recovery college successful, what kind of outcomes would we want to see, and then from there about how that might happen. That's about bringing together the different constituents.
Okay. Can I just ask a question at that point, sorry, because this is obviously a big issue, outcomes for lots of people. Do you have any experience yourself from your own service or other things you've heard of which you would point to as really quite good examples of kind of co-production in action in relation to outcomes and outcome evaluation?
So yeah, I guess in Sussex Recovery College, what we did was we asked a group of people as we were developing the college, before the first courses had run, we asked, well, what would make this recovery college successful? How would we know if it worked? And people who are currently mental health service users were saying things like, well, people would feel more confident. And one person said, oh, actually, we'll all have different aims, so it'll be different for every person. And so within the room, different people were suggesting things that they thought would be important. We then went away, and I think we talked about this a bit in the outcomes webinar last year. We then went away and looked at different ways of measuring the things that people had suggested and took that back to that group, where the group together was able to think that this is a measure that we like using, these are the ones we want to keep. And then a year later, we then reviewed that again, and students from the Recovery College were part of that alongside. We actually brought in researchers as well. So we had researchers, trainers, peer trainers, and mental health professionals, and students from the college. And we then refined which measures we wanted to carry on using and how we wanted to use them as part of individual learning plans.
And was it hard to keep that co-production kind of ethos running in this process? Because I know everybody knows that, as Waldo was saying, NHS mental health services now are subject to all sorts of external pressures about how to do evaluation and stuff. I guess it must have been quite hard to keep, as it were, the co-production flame burning, you know.
Yeah, I mean, in some ways, I think that somebody other than me might be the best person to answer that, because I think actually the students and the peers might be able to be better able to answer it. I guess I hold on to the fact that actually the measure that I wanted us to use wasn't the measure we ended up using, and so for me that kind of gives me a bit of an idea that probably we were co-producing it. And then interestingly, when we then spoke to the commissioners, the fact that we co-produced it and the fact that students and peer trainers have been so involved with it actually enabled us to persuade them that those were the things that they wanted to use as KPIs. So rather than them suggesting different things, actually because we'd co-produced it, they then accepted those. So I guess that's just one example of one of the aspects of Recovery College that we'd want to co-produce.
Can I just say, I have a slightly odd take on these outcomes things that formulate in my mind, because I think by virtue of us bending towards looking for outcomes that the traditional service wants, we're looking for traditional service outcomes. And I think we sometimes get lost in linking what are traditional service outcomes with, because that's how we might get refunded and recontinue with what real outcomes are. And I think what came out of the IMROC conference was enormous around social problems and medical problems and how we can conflate the two. Well, you know, I know within the Recovery College that when we talk around outcomes, somebody is going to say, well, I want stable housing. And to what degree do we have an ability to do that? Well, in some areas of London, Lambeth Council, where through an enormous crisis in the 80s, were able to create the landscape of how they created a community there to support each other. That's not to say they have any less worse housing crises than anywhere else, but addressing social problems is slightly different, and what the outcomes, therefore, of that are slightly different. And I think recovery colleges are around a social change, around how we can, or for me anyway, how I've managed myself and how I manage my social disability in a sense, and my social disadvantagedness, and in a way that by virtue of that, that's what are the outcomes that I want. They aren't ones that concretely can be supported. So what are the real outcomes that we're looking for? Less use of medical stuff, or you know. So, and the other thing I want to just
well, let you come back in.
Sorry.
I feel we have to having interrupted Sarah, we should let her just get back to her slide here about the different aspects of co-production. But clearly, getting the right kind of outcomes, which really reflect what is important to service users, is clearly absolutely important. So, thanks for that. Sorry.
Yeah, I mean, I guess one of the most obvious examples is about planning and co-facilitation of courses, and that's obviously really important that courses planned, are co-produced, are co-facilitated by someone with lived experience and a mental health professional. but actually maybe taking a step back from that, thinking about the curriculum as well. So I think in some ways it can be quite easy to think about co-productions being about the development of courses, but actually what's the bigger picture? The bigger picture might be about what kind of courses that we run and who have control over what courses we choose to have. So again, involving that broader range of people and thinking, I guess, thinking about students, thinking about peer trainers, thinking about mental health professionals, but I guess there might be other people who might want to be involved or we might want to involve in those decisions. So thinking really about people from broad groups of people. For example, we might want to think about people with learning disabilities or people with dementia. We might want to think about relatives and carers. What kind of courses would they like to be included in the curriculum, and how do we co-produce with that broad range of people and hearing voices that might not otherwise be heard? The very bottom one on that slide about academic boards or partnership boards, steering groups. So I think that different recovery colleges have called those meetings or organisations different names, but thinking about that kind of more senior level overrunning of the college, and again ensuring that that's somewhere where there's co-production happening, that most senior level.
So is that like about quality assurance, that kind of thing?
Yes, I think those might include about quality assurance and deciding the way that the recovery college is going to go and develop. So those might be groups where, or meetings where decisions get made about who's the recovery college for, so is it being broadened to younger people, for example, and in the end about quality assurance.
Okay, you haven't put sorry, Jeff, Sarah, you particularly, others as well, have put examples up of, you know, sort of lesson planning formats, the constitution of recovery college academic boards, and so on. So, well, when the website, the IMROC website, revivifies itself, members can find examples that they can then adapt to their own circumstances.
Yeah, absolutely. So different members who are listening now can be sharing some of their resources. And there's some quite good quality assurance tools that I think some of the colleges developed.
Well, I was just going to say, I like what you're saying, Sarah, because, you know, within our recovery college, we're now doing courses in the acute wards, 15 minutes in the rehabilitation service lines. And actually co-production, it's about driving shared decision-making at all sorts of levels. Yeah. So creating a recovery college course that we are going to be running in the ward needs to be created within that ward by those people owned locally and delivered locally. But the argument is always, well, how do we do that when people are particularly unwell? And it is possible, and we are doing it. It's about I suppose taking the plunge and having the ability or the chance and opportunity to do one. I think the example, and that's the power of recovery colleges and everything that you've just said. By making those examples, it makes it safer for other people to have a go at doing.
Yeah, absolutely. I'm just thinking there might be other groups. I'm thinking there might be, when we're thinking about co-production, there might be other people who bring expertise as well. So, for example, administrators who might not always be involved with some of the decisions, but actually they might have real skills, for example, around how do we co-produce about communications and marketing, or about student journeys, or about student pathways and progression. So thinking about the different kinds of people to include in a co-production process.
I think that's really
very good. And just if I could remind those of you who are listening that please, I've been interrupting and asking questions. You can do that too, and you don't have to save up all the questions to the end. If you've got particular points that are coming up, then do please just send them in, type them in, and we'll try and feed them into the discussion. Okay, just to move on then, Sarah.
Yeah, so I guess we were particularly interested in what we thought and what you thought, those of you who are listening today or who are listening later, about who needed to be involved with co-production. And I guess Walter and I were kind of raising a question, is it only co-production when it's between Recovery College and its students?
Yeah, and I think also, for instance, our deputy manager at the Recovery College is one of two people employed as a social worker. She's been a matron in physical health for 20 years. She's now been a social worker, but she is a peer as well. At what point does it become co-production? When staff are most comfortable to open up their lived experience, and I have lived experience who uses mental health services as a diagnosis, and actually sometimes because of that straddling of the fence, will co-produce with a peer or with a member of staff. Is that co-production? Can you wear two hats? So I think these are some of the questions that we wanted to sort of.
And that's important. Can you wear two hats at the same time?
Absolutely. Certainly, as far as the recovery college is concerned, there is only that one position where somebody has been employed as a professional with a lived experience. You're always only employed either for your professional expertise or your lived experience, and there's a very great distinction that we hold in that. But actually, it's about breaking down those barriers, and at the end of the day, when you think that the amount of people within my trust employs 8,000 people, and they can't even make a network, a secret designation of whether you've got a mental health diagnosis or you care for someone. So in a sense, is that how do we work those things out? And
and in terms of two hats, I'm thinking about people who might be students of the recovery college and might be trainers. So you might have someone who is a nurse or a psychologist and is also a student on a course. And which hat are they wearing when they're thinking about how do we organise enrolment, for example? Are they wearing their psychologist or nurse hat, or are they wearing their student hat?
And maybe it comes back to something you were saying earlier on, Waldo, about the principle of honesty. And as it were, being prepared to admit, that we're all much the same, under the skin kind of thing. And essentially that is an important principle of co-production, which needs to find its way into lots of interactions within big organizations like mental health services.
I think that's so true. One of the slides that we have, and make a big use of, is it's a frame of mind. Because when I was using services and I came in and I was on a user employment scheme, I arrived at the community day services that I was going to do my placement, and I felt included. And I was only on a placement. This is in 2009, and actually it was the empowerment I felt through that frame of mind that changed a great deal, the relationship I felt I had with those people there in support of me. And that's what we're talking about, honesty. And when we talk about those things, those are frames of mind, I think, and very much co-productions must start with that open frame of mind.
I think on the one hand, I think that you're right, and it is about a frame of mind and that way that we think about things, and we might have more than one hat. On the other hand, I think part of the honesty is about acknowledging that some of us have different levels of power. And so, for example, for myself, as someone who's been so involved with the Recovery College, my experience of registering for a course is really different from the experience of somebody registering for a course who's never had anything to do with the college before, maybe never had anything to do with being in a more powerful position in relation to services. So I do think we need to be kind of acknowledging and aware of our differences, and that might mean needing to include people who might have a different perspective.
And also thinking about the stigma and so on. Can I just say that in Nottingham they did a survey, and the little publication that came out of that was actually called Two Hats. And I can't remember the number of people who were asked, but it was between 30 and 40% of employed staff who had had a significant mental health episode.
Okay then. I think now, sorry, you were just going to talk about some very interesting research that Tony King and colleagues have done down in Solent.
Yes, I think Jane mentioned earlier Tony King's research. Tony King, many of you will have met at the last face-to-face learning network day that we held. She was present then. She works in Portsmouth. And for her master's, she carried out research. And again, actually, many of you might have been participants in that research. She was looking into co-production in recovery colleges. One of the aspects of her research was using the NEF co-production self-assessment audit tool to ask people about how much they were enacting different aspects or different components of co-production. So this slide kind of shows some of those. the ones at the top are things that recovery colleges self-rated themselves as being more skilled at or more doing, and the ones at the bottom are the things that required more improvement. So the ones that recovery colleges rated themselves as more excellent and making progress. In fact, 100% said that they were either excellent or making progress around mutuality. So that's about reciprocal relationships between professionals and with people with lived experience in developing recovery college. Again, shared roles and capabilities and thinking about assets and bringing together different people's assets and valuing those. So those are kind of, in some ways, the things that recovery colleges were rating themselves as being good at, or particularly good at, were about the internal operation of the college, the things that were about developing the recovery college itself. The two areas at the bottom are the things that recovery colleges rated themselves as being less good at. So in terms of networks, only 20% thought that they were excellent at this. Networks, those recovery colleges thinking that they needed to develop more or weren't so good yet at thinking about external networks, about the wider context, and thinking beyond the recovery college, the whole system, including people's own personal networks and, for example, faith communities, different sorts of networks.
Mm.
So let me just get my head around this. The survey then was asking people in recovery colleges which elements of co-production they thought they were doing well and which ones that they thought they were doing not so well. And the results, as you described them, seem to suggest that internally co-production is working quite well. That courses are being produced,
each other, they're co-producing courses,
and there's sort of blurring of roles and so on. But the co-production, if you like, outside the college, the kind of outward-facing aspects of the college, it really transforming a local community in terms of what it does and who's involved and so on. Those were the areas that they highlighted as needing a lot more work on. Is that right?
Yeah, absolutely. So the things that the recovery colleges needed to do more work on in terms of the aspects of co-production were about becoming catalysts to support the wider community we're developing, or involving wider networks outside of the recovery college and mental health service.
Jeff, just very quickly, I remember one of the things that inspired me when I came to one of the very first IMROC conferences, and I heard Julie talk around this Nottingham Recovery College that they'd started. They said that they were on the high street, and that actually people would walk up and a pair of people would pop it with pushing their pram and so what's going on in here? And they say, you know, this is what we do. And they say, oh, my son's great. Oh, I might come to this. That's the sort. Now they then moved to in the trust. They got the funding. They went in. Just much like us, we wanted to be outside in the supermarket, next to the supermarket. But it's in a sense, it's that, because we're driven to have to only now be open for our service users, or others have to pay. How difficult that you want to bring the public in. That's going to change, I think, with the GP commissioning landscape, certainly within our trust and in our area. And we'll talk about commissioning and things at some point. But I think, you know, those poor networks are because we are being sucked into our organizations, I think, sometimes, and we're not allowed to be on the high street.
And I guess that sucking might be about kind of having heads down, getting the work done, producing prospectus every 3 times a year. And I guess one of the reasons I was quite keen that we show this slide and talked about Tony's research was to remind us that we need to be thinking about those things and the things we need to be developing, because I guess in order to do co-production well, we need to be kind of thinking about how do we keep improving and analysing what we're doing.
That's really, I think it's really interesting, and I think there may be a kind of chronological process here, that you kind of start by putting your own house into order and then you kind of look outside. But also I think Waldo's point is very important for the future, because this question about where recovery colleges should be cited is a big issue, and there are advantages and disadvantages depending upon where it's placed. But anyway, we've got questions coming now from Anna Lewis. Hello, Anna. How are you? Some of the things you were saying, I think, particularly earlier on, Sarah, and it's just and Walter, sort of question about the notion of, as it were, people with two hats. Presumably the hat of, a professional, the hat of a service user, and Anna's sort of saying, isn't that actually a part of a kind of a rather old-fashioned thinking in terms of labelling, and surely the value of co-production is its process, and in order for it to work, it just needs more than one person talking, and we shouldn't get too hung up on the kind of labelling thing. I think Anna's asking. I don't know whether either you've got any comments about that.
I completely agree with her in lots of ways. I think labels are for jars, not people. but I also think, having had this argument in our recovery college, and it's ongoing, when we put our first slide up, we always put Waldo, senior peer trainer, Joe Brown, Joe Boggs, senior practitioner trainer, and I'm of the argument we just put Waldo, recovery trainer, Joe Boggs, recovery trainer. We're both recovery trainers, and in a sense just bringing different skills to create that mix. But sometimes I suppose it's about pushing an agenda and creating I suppose about creating the distinction to make sure it's apparent somehow that this process has to be inclusive, and it's not about watering that down, because ultimately I think Anna's point is right. We're all recovery trainer. There's no point, it's only bringing the voices in that's important. But at the moment we are so used to a system of exclusion and that I think it's important to retain a distinction to emphasize that togetherness. I don't know if that makes sense.
I think I sort of think that. I was thinking while you were talking, Waldo, actually when you were talking about how we introduce ourselves, so I normally introduce myself as a psychologist, or with my job title. Sometimes, particularly when I'm in the presence of people like Waldo or peers and carers, I might also talk, for example, about how I'm also a relative of several people who've got mental health challenges. And I was thinking about how, and I spoke at the IMROC conference last year, about how when a relative of mine went into crisis, about how it was for me as a relative, but I was also thinking while you were talking, Waldo, that actually my experience might have been different because I know quite a lot about the mental health service, it's about how to get people help, and it might be my experience isn't the same. So I suppose I'm thinking we need to not assume that because we've got two hats, we've got the same experience as somebody who's got a single hat.
Okay, well, I think it's a very subtle question, Anna, and I think it's something that we'll talk about for a long time. But I
think it's good that we don't know the answer, that we don't have answers.
No, I think that's right. I think it's really, as Waldo was saying, I think it's just a matter of making sure that, as it were, particular perspectives get fed into this discussion, because it is easy. We've all heard this, of saying, well, what do we need to employ service users for? All our professionals have got service user experience, so therefore we don't need them. Well, I don't think that argument actually holds water. But anyway, let's just move on, because we've just got a few slides now to finish up with, and have a little time for questions right at the end.
Yes, I guess the next thing we were thinking about was about what helps co-production, what facilitates co-production. I think we've got two slides on this. This first one is kind of about some of the kind of pragmatic, practical kinds of things. So it's important to allow time and space. I think you can't underestimate that it does take longer to be co-producing something rather than one person sitting down and writing a course or writing a plan for a service.
I think that's, for me, that's probably our biggest challenge in the Recovery College, as well as the thing that we have to make sure is ring-fenced, in the sense that we use a lot of associate peer trainers who are brought in to write the courses and to deliver the courses and things on a freelance basis, in a sense, as well, and that they're given the right amount of time to be able to feel that their contribution is of sense. And of course, practitioners are giving their time a lot of the time for free, or creating a space in their day when they don't have time to do it. So we're very keen to do it as quick as they possibly can, and to create that time and space helps create the space for co-production to happen.
And that time and space enables us to develop relationships. So I think really central is about relationships, about openness, about dialogue, listening. So yeah, without that, and I guess that relates again to that kind of frame of mind. Yeah. Some of the other things that I think we've identified, or people have identified as helping with co-production, training, so having a space or a training space to think about what is co-production and about how you go about co-production.
There's something quickly I want to say about that point. Yeah.
Just hold that second.
Yeah. Put a pin on it.
Having a sign-up of people at the most senior levels, both the senior levels in the trust and in other organisations, and commissioners. So when we have policy and guidance from the government, so I noticed that the 5-year forward document that came out a couple of months ago mentioned co-production and partnership working. Those kind of things enable us to kind of focus more and to co-produce. Yeah, noticing the outcomes, noticing how things are better when we co-produce them. But by bringing together the different kinds of expertise, we actually get something better. But also thinking carefully as we're getting bigger, so ensuring that as we're getting bigger, we continue co-producing and we take care over that. The other kinds of things that I think are about helping co-production are actually more about values, attitudes, frame of mind. So having values that are around reciprocity and equality. Really appreciating, genuinely appreciating the different assets that people bring, not lip service to that, but genuinely appreciating the assets that people bring. And so we've been talking about a little bit throughout the webinar, you know, acknowledging the differences in power. That includes acknowledging differences in power between people using services and people who work in services, but also thinking about differences in power between different kinds of people who work in services. So, for example, someone who's a medic or a consultant psychologist has really got a different kind of level of power than somebody who's maybe a staff grade working on one of the wards or a newly qualified OT. In thinking about power, it's also about having an awareness about whose interests are challenged by co-production, and that's needing to be willing to give up the power that we've developed over the last 50, 100 years. What else helps co-production? About being open-minded about what we're trying to achieve. So I guess that comes back to having co-production right from the very beginning. So thinking about our intentions and what we want to get out of what we're doing has been quite open. That could change. I might have an idea, but it might not necessarily be that we follow. So not coming in with set ideas about the aims. And involving right from the very start with setting priorities. And again, having that critical review, so striving to improve co-production, not resting on our laurels. Waldo and I were talking on our way to the webinar, we were kind of thinking, well, in 10 years' time when we look back, what will we think about the co-production that we've been doing in 2016? Will we kind of have moved on? Will we think that actually back in 2016 maybe we were just at the start of a journey about co-production? So kind of always striving to improve, and I think that's one of the things that will actually help co-production by being critical of ourselves and having that sense. Very
good. Sorry, Waldo, I interrupted you in a minute.
No, I just wanted to say around training, because at the Recovery College, I think co-production, it's not just about employing any old service user to come in and latch on and we'll give them a bit of training and they can be. Actually, you know, the peer trainers in the Recovery College, when they're being recruited and looked at, they're bringing assets that enable them to be peer trainers ultimately. I mean, I hadn't got down and stood up in front of a room in my life before, but I've been an assistant director on film sets and done something else that made thousands of people. So it's like something in. So I think there's an element of that. I think that it's so important to find something that's reciprocally valued. It's not, you know, you can't have, it's very hard to be co-productive when someone in the room's on £60,000 a year and someone in the room hasn't got a house to live in. And to think that, okay, well, we're giving up the power, don't worry, okay, I'm going home in my Mercedes. And so it's not to say that everyone has to be on £60,000, and it's not, but there has to be reciprocal value to what you're asking for people to do. And the last thing I just wanted to say is an interesting thing that's happened within our hostler. It's actually, you know, a lot of the staff are terrified of the peer support workers and the peer trainers, because it's not about tipping the balance the other way either. Because they say, you don't know what it's like, because I'm the one that's lived through that, and you're supposed to recognize that as the value it is. So it's very careful. You have to be very careful about in both aspects.
And so something there about paying attention
to the differences as well. Yeah.
Well, thank you, and again, you know, I think honesty is a word that comes to mind when you're talking, Waldo. Well, look, we're sort of coming to the end now. I wonder, have there been any more questions? Okay. I'd like then to ask a question. Just supposing, I was a very hard-headed manager, big problems with my budgets, getting everything, you know, to stack up, and I'd heard about this co-production, and it sounded very humane. It sounded quite, you know, a nice way to be and to respect other people and so on and so forth. But you know, I knew that it was going to take a long time. It was going to be difficult. It required my staff, you know, to change their attitudes and so on and so forth. It wasn't the easiest thing in the world to take on. Why do it?
So I guess it sounds like you as a hard-headed manager are kind of really quite interested in that, like the bottom line, which is not surprising given the economic climate at the moment. I suppose one of the things I'd want to say to you is that actually I think it's the evidence is in fact that when we focus on quality, and I think co-production is a really good way of improving quality, it's when we focus on quality that we actually get those differences at the bottom line. So by focusing on the quality, we can actually make cost savings rather than on focusing on the money and the more tangible aspects of money.
Thank you, sir. That's a very interesting point.
I'm afraid I'm more of a cynic. I think you're sick of hearing about more quality, because you get that all the time. I think I need to tell you, by involving these people, you're hitting certain benchmarks that the CQC and that the Trust has set out, whether that's through recovery trips, whether that's through CPD, the continual professional development points that you have, or whether that's around how much you're involving your patients in whatever and what outcomes that gives your department. And I think you need to have concrete incentives. It's rather like the glass ceiling with women's rights. In actual fact, you don't need legislation to have, but there needs to be something to incentivize the breaking of that ceiling at some level within the FTSE 100 and things. So I think managers react better to that.
So I think in some ways you're saying, well, there'll be intrinsic outcomes that will be helpful to that manager, whereas I'm saying that actually the improved quality will affect the kind of overall outcomes for people using services, and again that will kind of...
I think that's true. And I mean,
Jane, did you want to add anything to that?
Well, I was just thinking at the last face-to-face learning day, we had a commissioner from Dorset came up, and whilst she and her colleague were talking fairly generally, I think that where you have got enlightened commissioners or commissioners who are prepared to learn and go to, we're talking about the recovery colleges, go to the recovery colleges, spend a day there, talk to people. If you can get them there, in my relatively limited experience, they're just blown away.
So, I mean, again, what I hear you all saying in different ways is that the way forward here is to make sure that the managers and the commissioners know that these developments will make their jobs easier. They will address their problem.
Yes, absolutely.
Whatever it might be. I think we've maybe got time just to squeeze in a very last question from Anna again. And she says, get hard-hearted managers who are converts speak to others and use the power of their peer relationships, which I think is a very good piece of advice. Thank you for that.
Thank you.
Well, thank you very much to Jane and to Sarah and to Waldo for that. I hope you found it a useful discussion. The slides will be available, I think, on the website. There are some suggestions about some further reading there, and thank everybody, and thank you for tuning in. Thank you.
Thanks.